How do you do? Mr. Hafeez Haider.
Yeah, I'm fine, Dr. Shanna.
How can you help me for preparing the lecture? Autism spectrum disorder.
Yes, I have a good command on this topic because I am a clinical psychologist.
Oh, so please help me.
Yeah, sure. Autism spectrum disorder is a developmental disorder that affects communication and behavior. Although autism can be diagnosed at any age, it is said to be a developmental disorder because symptoms generally appear in the first 2 years of life.
Oh, first 2 years of life?
Yeah, first 2 years of life. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, a guide created by the American Psychiatric Association used to diagnose mental disorders, people with autism spectrum disorder.
I think the book is very interesting.
Yes, this book is interesting. Difficulty with communication and interaction with other people, restricted interests, and repetitive behaviors. Symptoms that hurt the person's ability to function properly in school, work, and other areas of life. Autism is known as a spectrum disorder because there is wide variation in the type and severity of symptoms people experience. Although autism spectrum disorder can be a lifelong disorder, treatments and services can improve a person's symptoms and ability to function. The American Academy of Pediatrics recommends that all children be screened for autism. All caregivers should talk to their doctor about autism spectrum disorder screening or evaluation.
Nice information, Mr. Hafeez. Can you tell me more about this?
Yes, sure. People with autism spectrum disorder have difficulty with social communication and interaction, restricted interests, and repetitive behaviors, such as making little or inconsistent eye contact, tending not to look at or listen to people, rarely sharing enjoyment of objects or activities by pointing or showing things to others, failing to or being slow to respond to someone calling their name or to other verbal attempts to gain attention, having difficulties with the back and forth of conversation, often talking at length about a favorite subject without noticing that others are not interested, or without giving others a chance to respond, having facial expressions, movements, and gestures that do not match what is being said, having an unusual tone of voice that may sound sing-song or flat and robot-like, having trouble understanding another person's point of view, or being unable to predict or understand other people's actions. Others restrictive, repetitive behaviors may include repeating certain behaviors or having unusual behaviors. For example, repeating words or phrases, a behavior called echolalia, having a lasting, intense interest in certain topics such as numbers, details, or facts, having overly focused interests such as with moving objects or parts of objects, getting upset by slight changes in a routine, being more or less sensitive than other people to sensory input such as light, noise, clothing, or temperature.
Good information, Mr. Hafeez.
Thanks, Dr. Shanna. Most of the time, people with autism spectrum disorder may also experience sleep problems and irritability. Although people with autism spectrum disorder experience many challenges, they may also have many strengths, including being able to learn things in detail and remember information for long periods of time, being strong visual and auditory learners, excelling in math, science, music, or art.
Wow. Mr. Hafeez, can you tell me about the causes and risk factors?
Sure. While scientists don't know the exact causes of autism spectrum disorder, research suggests that genes connect together with influences from the environment to affect development in ways that lead to autism spectrum disorder. Although scientists are still trying to understand why some people develop autism spectrum disorder and others don't, some risk factors include having a sibling with autism spectrum disorder, having older parents, having certain genetic conditions, people with conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome are more likely than others to have autism spectrum disorder. Very low birth weight.
Well done, Mr. Hafeez.
Thank you, Dr. Shanna.